Hello, my name is Emelda Ndinjakat and I'm recording a video on mental health. This is week 2 discussion and I'm of program group 221 and I'm going to read the question. So the question goes as follows. A team approach is useful in dealing with the multifaceted problems of clients with mental illness. Describe the role, functions of the interdisciplinary team in the collaboration of client needs. So I'll first begin by giving you a definition of what a interdisciplinary team is. An interdisciplinary team came about because, as you know, in the healthcare field, there are different levels of expertise. But with these different levels of expertise can come a lot of confusion, especially for the client. So this team was created because, as in mental health, the patient has mainly 5 disciplines that they're dealing with. They are working with a nurse, they are working with a social worker, they are also working with psychology, with psychiatry, and sometimes activity therapy. And these 5 disciplines are not just the 5 disciplines that are out there that helps the mental health client, but like in the VA hospital, from my research, I saw that they have even up to 12 disciplines. But for purposes of this discussion, we are going to mostly focus on the 5 main ones. So this team has a role and they have a function to work together to see that the client who has the mental health illness at least gets back to some form of normalcy. So number one, their function is to evaluate. To begin with, they have to assess and they have to evaluate the patient together to see, to put short-term goals for the patient and to put long-term goals. And this is going to eventually assist this patient and when they are doing the evaluation to see if the outcomes were met. Another thing that the interdisciplinary team needs to do together is to include the patient in his or her treatment plan as well as the family, because as research has shown, when a patient and a family member is involved in their own care, then the chances of this patient getting treated better and feeling better faster increases. So that's one of the things that the interdisciplinary team has to do. One of the other things that they also have to do is that they have to ensure continuity of care. So, for instance, if you have a client with a mental illness in a facility who is having depression or having any other mental illness, whenever the time comes for their discharge or for them to move on from wherever they were, continuity of care has to be taken care of. And so that's where all of these team members come together. So let me give an example. When you have the nurse who works in a facility, she works hand in hand with the social worker, because the social worker's duty is to make sure that this patient, when they are discharged, the home health or whatever that they need after that is taken care of. But that cannot be done without the assistance of the nurse, and at the same time with the psychiatrist who is also working with this patient, and the psychology and also the activity therapy. So all this team has to do is to really come together to work together. And to do this, what they need most of all for it to be effective is open communication. Without open communication, it's going to be very difficult for the interdisciplinary team to really do a good job. And by that, in order to achieve that, they need to attend regular meetings to see where they had set their goals at the beginning, and where, if these goals have been met, and if they have not been met, to reevaluate and to see how they can do better to assist this client. So when this is done, at the end of it all, the client does not feel confused about his care and is wondering that, what exactly am I doing? But the different steps that the interdisciplinary team has put in place will assist this client to get back on his feet. So a lot of structures have to be put together in order to do that. And some questions that need to be asked is like, who is in charge? So that to make sure that even though these fields have different expertise, nobody is stepping into another person's field, because when that happens, then a lot of confusion ensues. So you don't want that to happen. So most of the time, the doctor will take charge, or somebody will take charge to be able to coordinate this team together, especially when they come together during their general meetings. So at the end, the client will really feel that he's been well taken care of, not only by him, but also by the family. And when it comes to billing and other things that have to involve the patient, so all of these facets are going to come in together. So those are the roles and functions of the interdisciplinary team, and as you can see, they have a lot of work to do. It's something that is very complex, especially nowadays with the hospital system having a lot of different expertise. It's hard sometimes to have communication flow between different departments, but it's very important for the team to do that together, not only for them but also for the client. So I'm going to go ahead and read the next question that is asked. The question says that poverty among persons with mental illness is a significant barrier to maintaining housing in the community. Discuss the special needs of the mentally ill population. So as you can see, the mentally ill, they have a lot of challenges that they face, because most of them, if they don't have a very good support system, they end up being homeless. And from my research, from the Substance Abuse and Mental Health Services Administration, they stated that about half of the people who are mentally ill, they end up using a lot of drugs, and they end up being on the streets. And this is such a very high number, because when you are mentally ill and you end up doing substance abuse, it's very, very difficult for you to maintain a job. And when it's very difficult for you to maintain a job, then the chances of you becoming homeless are even higher. And also, one of the problems that they face is that because they have a mental illness, for instance, like they are depressed, they don't want anybody around, or they have a disorder like a dissociative disorder or ADHD or any other disorder that you can think of in mental health, the tendency is to drive away family members, is to drive away caregivers. And when you do that, then you become alone, and you lose your support system. When you lose your support system, then it's very easy to find yourself on the street. And at the end of the day, they get into shelters, and they get into other places where the government can assist them. But even then, this is not very helpful to them, because when most of these mentally ill people become homeless and then they go to shelters, they are susceptible to diseases. And when they become susceptible to diseases and infections out there, because they are all grouped together in one place, then they get ill, and then they get back into the hospital. They have a lot of medical bills to pay, and they are not able to work. And so this is a very, very high, the chances of this person becoming homeless is very high. So as you can see, the mentally ill person has a lot of difficulties finding a job, having a job, and then eventually becomes homeless. Another problem that the mentally ill person faces is that when they live amongst people, the general public, and they live in a home amongst neighbors, the chances of them having problems with the neighbors around them is also very high, depending on what kind of mental illness they have. And also, this ends up becoming a problem. For instance, if they're living in a homeowners association area, or in a kind of a place where many things are not tolerated, and they end up not being able to stay in a home, and they move from house to house. They end up in apartment complexes or in sheltered homes, or they end up living with a friend. And all of these are definitions of homelessness, because they cannot own a home that belongs to them. They're unable to pay the bills. Luckily, there are so many government agencies out there and charities out there now that have been created to help the mentally ill, and especially the homeless persons. And so this has kind of helped to be able to alleviate some of these problems. So I'm going to read the next part of that question. Says that you should compare and contrast the homeless client with the mentally ill homeless client. So as you can see, these are two different people. One person is mentally ill and is homeless. The other person is just homeless but is not mentally ill. The person who is just homeless and has no mental illness has a greater chance of not being homeless anymore, because this person might have had a work history that he has built over the years. And so with this work history, when he goes out to apply or he goes into these unemployment agencies, they are going to assist him better to find a job. But take, for instance, a patient who is schizophrenic or who has depression. Think about that patient going out there to look for a job. Number one, he has not built any work history. So that's going to be very difficult for the get-go because he doesn't have any experience built up to have a job. And when you don't have an experience built up to have a job, then it's very difficult for you to actually be hired by the employers out there. Number two, even without the experience, you've not built, you don't know exactly, you don't have skills that can help you, assist you to work. And so when you don't have skills, it's very difficult. The number of jobs that are out there for you is very limited. And because of that limit, there is the chances of you becoming homeless are very high. And also for the mentally ill person, most of them, they have a huge disadvantage because when they have an illness that is difficult for family members to help assist them, not only emotionally but physically, then they get into things like drug abuse. And when they get into things like that and other things that are not good for them, then is one of the things that they will end up finding themselves in is probably being in a rehab instead of looking for a job, and that they are not going to be able to find a home. So as you can see, there's a great contrast between a person who is just homeless and a person who is homeless but mentally ill. So in order to assist these clients, the first thing, as we were talking earlier about the interdisciplinary team, they work on a holistic approach. So they don't only work with the mental person. They don't only look at, okay, this person came in with depression, and so we're going to only treat depression. They also look at, okay, what caused your depression? Why did you come into the facility today? How can we assess the whole person and assist him not only physically, but also mentally, spiritually in some cases and otherwise, so that when you treat the person as a whole, then the chances of that person becoming homeless decreases. And also when you include the family into this person's care, then the family also may be able to understand the disorder better and not run away from their family member who is suffering from a mental illness, but try to understand them, take them to treatment, and this is going to assist in helping this individual get back on their feet. So as you can see, there are so many facets to this problem, but the government has instituted several agencies, and also there are so many charity organizations out there that are out there to help the mentally ill, and from research it shows that the mentally ill population, even though poverty is a huge factor in making them homeless, there are so many things out there to help them now develop new skills as they become better and they go out there, and it can assist them in finding jobs to be able to maintain their homes and not to move from place to place. So for this, my discussion, I had 3 references. One of the references is our school book. It's Psychiatric Mental Health, Nursing, the 7th edition by Sheila L. Wiedebeck. That's one of my references. Another reference was from Medscape, which is a very reliable source. And one of the titles is Mental Illness and Homelessness, is published by the National Coalition for the Homeless in July 2012. And my last reference is called Enhancing the Effectiveness of Interdisciplinary Mental Health Treatment Team, and this was published by Diane Vinokur, who has a PhD. So thank you very much, and I hope that you enjoyed my presentation. I can't wait to hear your feedback. Thank you.